these are different is because the bars are shorter. Because again, we're trying to cut back on that distance that we're having the tube head to the patient's face. Okay? Your existing arms may work, because some of them may be just about the same size. Like this one, not much longer, so this one would actually work. The only one I was looking at that might be a little bit too long is your posterior arm. Okay? Other than that, these are exactly the same. So you've got your posterior arm where everything's in a flat plane, prongs come off. Okay? Then you have your anterior arm, which has an additional right angle bend. So again, the prongs are coming off at a perpendicular angle rather than parallel. And then of course you also have your bite wing arm, which has no bends, it's just a straight bar with the prongs. Same rings apply. So our yellow ring is our posterior ring. Okay? The blue ring actually doubles because it can be used as an anterior ring or as a bite wing ring. Okay? So that's what kind of makes it nice. The big difference is going to be the holders themselves. Now this one is a posterior. You'll notice that it's color-coded to the ring. Okay? I don't know why they did this.
They have some white rings.
White holder, which is for the anteriors, goes with the blue ring. But they did get it right on this part. The bite wing holder is blue, and it does match the blue ring. I don't know who made the decision. It was somebody up with more authority than me. Okay? Now,
kind of funny.
Now the way these work, these have adhesive on them. This piece is disposable. So after it's used on one patient, it gets disposed of. They come on strips, so when you order them, they'll be in a bag and they'll be on a long strip. Normally I just cut them apart, making sure that we just keep the cover on them until we're ready to use them. Okay? You simply peel the little plastic off, and then what I normally do is I just kind of hold the sensor and roll it against my thumb and then kind of squeeze it just to make sure we get a firm seat. The cable should always follow the path of the arm. Okay? So if I had it on like this, it's the wrong way because the cable would be aimed down the patient's throat. Okay? Now, working with this, right now, I can get it positioned where I want it. Okay? I normally kind of adjust it up or down depending on the patient. Okay? Sometimes, if you were clipping off too much of the apex, if you'll peel it off, slide it down just a little bit, and then reattach it. If I'm losing too much of the incisal or occlusal edge, then I move it up a little bit. Okay? Now, at this point, I normally loop, or it's not really looping, it's draping the cable across the arm. That just kind of helps keep it out of the way. Okay? Instead of on this side where it tends to exert a little force. Okay? So if we bring it back this way, it doesn't tend to push on that as much. Okay? So right now I'm set to do patient's upper right posteriors. Okay? Molar, premolar. Without taking anything apart, I can now do the lower left. And that's an important thing because we're going to talk about in a little bit the image templates. The templates will be set up in a way where they move in a certain sequence. Okay? So if you're doing a full mouth series, it's highly advantageous to use it in that method where you go upper right, and then without taking anything apart, flip it completely over, lower left, lower left. Then at that point is when I would go ahead, flip my ring, peel my sensor off, flip the bite block, then I would go ahead, reattach my sensor, go ahead and drape my cable. So now I'm ready upper left, or I can flip the entire thing over, lower right, lower right. So that's the posteriors. With the anteriors, of course, anterior arm, anterior ring, and the white holder. Again, what I normally do is just kind of put a finger at the bottom, kind of brace the bite block, squeeze it. Again, I still drape my cable. Nice thing about the anteriors is you go 1, 2, 3. You just flip the entire thing over 1, 2, 3. Okay. The anterior arm also doubles as our bite wing arm. So again, just peel the little adhesive off. So now I'm ready to do right, right, left, left.
Is there holders that do vertical bite wings if we have a dentist that wants a vertical bite wing?
Actually, you would use this same holder.
Okay.
Okay. Basically, you rotate it, and normally we do it so that the cord is up in the mouth.
Okay.
Okay. So if I'm on this side, boom, boom. But when I move over to this side, I'll want to peel it off, spin it around, and reattach it.
Okay.
Okay.
The cord up.
Yeah. Yeah. Normally go cord up. Okay. So, any questions about holders as far as the XCPs go? Okay. We always recommend using these because it ensures that you get a nice clean shot. Okay. Eliminates or helps eliminate overlapping. Okay. Cone cutting, things along those lines. Now, they do also come with, and I see that you have them, little bite wing tabs. Okay. These are basically just pull off and stick on, and again, you can put it in a horizontal or a vertical position. Particularly, I don't like to use these because A, I don't think they're long enough. Okay. So in some cases, especially when we kind of turn it to take that premolar shot, there's not quite enough room for them to close down on. The other thing is that it's hard to control in place using this. Whereas when you're using the arm, you've actually got control by using the arm itself. Okay?